So we will get started. You're good, Alex, to get started?
Yeah.
Awesome. Okay. Well, I'd like to say thank you so much for those that are joining us. There will be a few more people coming in and hopefully wouldn't be too disruptive. I know it is a Tuesday evening and you guys are just probably about to have your dinner, so feel free to have that while you're enjoying this webinar as well. Before we get started, just a couple of things for housekeeping. If you do have any questions throughout the webinar, feel free to post them below in the chat box, and we will get to them at the end of the webinar. You can also post that into the Q&A, or you can raise your hand. And once we see that, we will be able to ask you to speak if you're okay with that, or you can simply type in questions. And so hopefully everybody's got all that. And again, this is more of a discussion. We want to hear your feedback. We want to discuss these points with you. So feel free to keep that dialogue and that line of communication open. So I'd like to start off by introducing Alex. Alex is a massage therapist at Care at the clinic here in Lindsay. She graduated from Fleming in 2020. Is that right, Alex? I'm getting my years all mixed up.
Yes, that's correct.
Perfect. So very new grad, but she's taken the clinic by storm for sure. And we are so excited to have her with us on a day-to-day basis. It's been amazing. Your knowledge, Alex, charisma, and obviously the love of learning that you have. It keeps us on our toes, and we love that as well, being old grads now. And today I'd like to introduce Alex because she has a wealth of knowledge that she would like to share with all of you guys today. And so I will, give over the mic to her and let her do her thing.
Beautiful. Thank you, Manju. So like Manju said, my name is Alex. I'm a registered massage therapist at Care. I am full-time there. I started back in May, so it's been a little while. It's still pretty fresh, but I'm starting to get my hands wet a little bit more. So I'll start by sharing my screen to get the webinar started. Beautiful. Can somebody confirm that they can see my presentation? Just give me a nod. Good.
Perfect.
Okay, perfect. So today I'm going to be talking a little bit about biomechanics and how the biomechanics of your feet will affect the rest of your body. We'll be talking about the whole body as a structure, but the focus of the primary cause being a condition in the feet or just a dysfunction in the feet anatomy itself. So today we're just going to be talking a little bit about biomechanics. I'll let you know what biomechanics is. If there's any terminology that you're unsure of, just feel free to raise your hand if I'm not being clear enough with how I'm explaining things. We'll talk about some relevant anatomy and we'll go too in depth because it's very, it's crazy how much goes on in the feet in such a small structure. We'll be talking a little bit about gait and what that means and what that could mean for you. We'll be talking about how your feet are affecting the rest of your body from the ground up. We'll be talking about some common foot and ankle conditions that you may have heard of or that may be affecting you. We'll be talking about the importance of functional footwear in your day-to-day life, as well as orthotics and how those may affect you. And we'll conclude with a little bit about how the Care team can help you with your health overall and how they can affect your feet. So like I said, a little bit about me. I'm an RMT and I like to focus my treatment on some active release therapy, which means that you are moving while I'm either pinning something, you're stretching, such and such like that, some exercises while during my treatment. I have a background in sports, some concussion rehabilitation, some foot and ankle treatment as a patient and as a therapist myself. Having a background in sports has helped me immensely in my practice. Some concussion rehabilitation as well as a patient and as a therapist. I find it I'm very passionate about it. I'm very interested in concussion rehab as well. My patient population at this time is mostly prenatal and postnatal patients, as well as some lower back pain. But like I said, as I am full-time, I'm really just getting my feet wet as a new RMT. So I'm seeing a little bit of everything and I'm super excited about seeing anything I can. It's all very, very exciting for me. It's a new grad. So we'll get started by introducing what biomechanics are. So biomechanics, by definition, are the study of the mechanical laws relating to the movement or structure of living organisms and the analysis of the mechanics of human movement. So biomechanics is a combination study working with physical engineers and members of the medical community to see how your body moves in space. So there's focus in different areas like your occupation when you're working in that environment, sports and orthopedics, so that athletes can get optimal results in their performance with their biomechanics, as well as orthopedic biomechanics, which is amputees, orthopedic implants like hip or knee replacements. Biomechanics looks at that as well. Today, we're just really going to look at human movement biomechanics, which is really just what's happening when you're completing movements like walking, running, sitting, standing. What happens in your biomechanics when something in your feet is happening to decrease your quality of movement and what's happening there. So a little bit of anatomy of the feet. So this is just, so I have an extra foot here. So this is just a little diagram of some of the anatomical structures of a human left-sided foot. So different parts of the foot are responsible for different parts of movement when you're walking that we'll talk about here in a minute. But there are over 100 muscles, tendons, and ligaments in each foot, not including nerves and blood vessels. So it's a lot going on. You do have various different joints, regions, and bones of the foot. So like I said, it's a lot compacted into one small structure. So that's how when one thing goes out of whack, it affects a lot of other pieces. So the three regions of the foot are your forefoot. So that's at about here. That's just about your heel, your ankle, at that movement there. Your midfoot is about just the beginning of your foot there. And then the forefoot is just all here. So it's all your toes, your longer bones of your foot. The foot is a very rigid structure, but it's very important for weight bearing, for shock absorption. There's some flexibility that will account for if you're walking on uneven terrain, if you're on a hike, your foot will give a little bit, but it really is an important thing that it stays together. So some of the joints have very little movement and some have a lot more, like the ankle. So there's the two joints that are most responsible for your ankle movement are talocrural and subtalar. So your talocrural joint is what's working when you're on your tippy toes. So when you're going up with your ankles and down, and your subtalar is when you roll your ankles, when you're going side to side. So most of the other joints have a little bit less movement than those, but they're all very important for making your foot move properly. So now actually, I'd like to go back just for a second. So another structure of the foot that's very important are the arches of your feet that you've probably heard of before. They're very important for the structure of your foot, for how your foot will move with the rest of your body. They help dictate a lot of the movement, how the chain reaction will happen. So there's three main arches of your foot, so the medial, the lateral, and the longitudinal. The medial and the lateral mean inside and outside. Longitudinal means like side to side like this. So when one of the arches is fallen or damaged, you can find yourself in more of a damaged position. So your foot will be fallen, it'll be higher, or it could be in a different position than what it should be to allow you the best quality of movement, best quality of life. So for example, when a bone in your foot is broken, an arch can be damaged because the arches do connect to the various bones, like you can see here. So if you see this arch, it's connected to these bones here. So if you were to break this bone, it can really affect the arch. So if you were to break your foot, going to physiotherapy is important because you need to be able to rehabilitate all of the structures of the foot so you regain proper function. So when we get into gait, if you haven't heard of gait, it's simply just your pattern of walking. So if you have ever gone to anybody that's assessed you for orthotics, if you've gone to a chiropractor, physiotherapist, massage therapist, it's an analysis like that. That's when we just watch you walk. So we analyze your different stages of gait, what's happening at different key joints in your body when you walk. We look at what may be the cause of a damaged gait if you're getting foot pain when you're walking, if you're getting hip pain, it may be caused by your feet. So physiotherapy is the most clinically proven method to improve your gait, so reduce any discomfort when you're walking. In any assessment, it's very important to talk about the primary cause of or painful gait, which could be where you're having the most pain. If that's on the inside of your arch, if that's in your toes, in your ankle, if it's on the inside of your hips, on the outside of your leg where your IT band is, it's always so important to communicate that with your therapist. It could be caused by that fallen arch, like we talked about, poor foot mechanics, if you're not wearing proper footwear, or it could be caused by your hips. It could be caused by a knee structure problem, or it could be all together. So your feet are causing that knee problem, that hip problem, that we will always address the primary problem and treat the cause if we can. So some of the things we're looking at is your heel strike. That's your first step. So if it's too heavy, if there's too much shock going into the feet, that we could help with. If it's not used enough, or if you are having a drop foot, if you are dragging your foot when you walk, it's all important things that your therapist will look at if you're coming in for a foot problem. Or something more common in myself as well is if you're not making sufficient use of your hallux bone, which is in your big toe. So if you are looking on the inside here, if you're not using this enough, it can decrease in movement, which is where you'll get your bunion. So we'll look at how the feet are affecting the rest of your joints as well. So when a healthcare practitioner is looking at your posture, looking at your gait, we're looking at the relationship between different joints in your body. Like I said, like the ankle, the knee, the hip, the shoulder, the neck. We're looking at the alignment and shape of your spine, if there's any excess or limited movement in any of your joints, if there's a muscle imbalance in any different planes of your movement. It's all very important to put it all together. We know you're trying very hard to have a perfect posture when you're looking at you, but we can usually find it if we know what we're looking for. So if you look at this one here, you can see the difference in the arch. This is more of a pes planus, so a fallen arch. So if you have your fallen arch, if it's very flat, if someone feels the bottom of your foot and it's very flat like that, you'll see in my little diagram here that it will affect the knee. The knee will start to cave in. Your hip might rotate, which could cause some lower back pain, which will cause a change in the shape of your spine, affecting your neck. And if it's only 1 foot, it could cause a muscle imbalance from side to side. It could be tilted, which could cause some pain. If you go see one of our chiropractors, Dan or Jill, they might be looking at your hips and say, oh, this one's higher than the other. This one's lower. That could all be affected by the way you walk, and it could cause you pain when you're walking, when you're running, trying to exercise. Patients come to me all the time and they say, I'm having some pain in my lower back when I'm walking, or I just got orthotics and now my hips hurt. They never hurt before. So that's because when you get the orthotics, you're being put into a different position. That might be why you're having some pain. You're not used to being in a different position when you're walking, which is where you were supposed to be. Or you could have the higher arch, which is something I've seen a little bit less. The fallen arch is a little bit more common for my patients, especially. But when you get the higher arch, everything's being pulled upwards. You can get this hammer toe in here. You can get some strain in the knee, especially from trying to be locked all the time when you're on that higher arch. Some instability in the ankle. It's starting to roll outwards when your arch is higher like that. So you get the opposite effects of when you get the fallen arch. So that's how your feet start to affect the rest of your joints, especially over time. If you are changing the way you walk, especially if it's later in life, you've walked this way for a very long time. It's not impossible for sure. It just takes some practice and dedication to make sure that all of your joints are as healthy as they can be. And that's what we want to achieve at Fourth Care. Some common conditions when it comes to your feet are, like we talked about, the subtalar joint. If it's not moving properly, that can cause your shin splints, your pain when you're walking. If you're going up a hill, especially if it's hilly or even terrain, you can get that pain in the ankle and the feet. Planter fasciitis is super common. That's when there's fascia on the bottom of your feet, just lines it. There's so much fascia there that if when you're walking or if you're not wearing proper footwear, that fascia can get very inflamed and cause pain, especially when you first wake up in the morning and you step on a flat floor. It might have a very initial shock of pain and, wow, that hurts. I was sleeping. I wasn't even exercising, but it's because your fascia is inflamed. So some proper footwear and treatment is the best treatment for that one, especially your bunions. So when you get that outward cave of your big toe, that can be caused by your decrease in your hallux bone. If you're not walking properly, especially over time, a good sign of that when you're younger, like myself, is when you have a larger space between your big toe and your second toe than the rest of your toes. That's a good sign that you're not walking properly. If you look for that in yourself and your kids and your friends, it's a good sign, hey, you're not walking properly. You should go see Dr. Jill or Dr. Dan or RMT Alex at Fourth Care. So or like I said, that pes planus, that fallen arch, that can be affected, like we talked about already. So if you're thinking, hey, this might sound like me, some common symptoms are if you're having foot or ankle pain when you're walking, if you're not wearing proper footwear, if you're getting pain on that plantar surface in the morning, like I said, if you're having some restricted movement in the toe joints, if you have some difficulty going on your tippy toes, if you see that your toes are up a little bit upward like that, like I showed you on that foot with the hammer toes. If you have any bone deformity on the inside of the big toe, like that bunion we talked about, or any heat, swelling, or pain at the back of your ankle, that can be a sign of Achilles tendonitis, which is the tendon that you see at the back of your ankle. It's like a little rope going up the back of your leg. If that's where your pain is, that's Achilles tendonitis, and you should pay us a visit for sure. So let's talk about proper footwear. So some important things to look at is there's some do's and don'ts that are important. Ladies, no high heels. They're very bad for your feet. They're not good. They are not good for your arch, not good for your heel, and not good for the knee for sure. So you're putting too much strain and it's not enough arch support. It's hard on your balance. You're more prone to ankle injuries, as well as on the opposite end, your Vans, your Keds, your Converse don't have any arch support for you. It's not great when you're exercising unless it's for some heavy weightlifting. That's when it can be beneficial. So that's why that little star is there, is because except when you're doing that heavy exercise, if you are squatting, if you're doing some deadlifts, that's when your Vans, your Keds, and your Converse can be great for you. They can be great for the structure when you're exercising. But if you are walking, running, jogging, doing any of those cardio high impact exercises, that's when your good footwear is important to help your feet with that shock absorption, to help with the rest of your body. Flip-flops, again, have very poor arch support. So flip-flops are a no-no, but I know I love my flip-flops myself in the summertime, but they're not good for your feet. Back to the high heels, your platforms and wedges aren't great either because they don't have any give. There's no shock absorption. They're very firm. So it's not great for your feet to be walking like that. You have your heel drop, your heel strike, and then you slam right down because of the way the platforms are built. So they're not great for your feet either. Your pointy toes, the pointy toed shoes, that goes for men as well, and their dress shoes. They squeeze the toes in tight, so it's hard to get that motion when you're trying to toe off in your gait. So those aren't great for your feet either. As well as they're called minimalist shoes. So those are the shoes that they make you want to feel barefoot. If you've ever seen the shoes that have the toes in them as well, those are what minimalist shoes are. So those are more for they're not great because your toes aren't used to being separated that way. And there isn't a lot of support in them as well. And there's really nothing to them. That's why they're minimalist shoes, and that's why they're not great. And shoes that are too small, 9 out of 10 women are wearing shoes that are too small for them, that do not fit properly. I was guilty of this as well. So I am 9 out of 10. But if you're wearing shoes that are too small, your feet cannot expand, absorb properly. You can't balance properly. It's very important that you have shoes that fit. If you go somewhere that will size your feet for you properly, that will give you a size that works for you. If you have wide feet, long feet, myself, I have wide feet. So men's shoes are better for me because they're a little bit wider and they can fit my feet properly. Things you want to look for in your footwear is a 12 millimeter heel rise shoe, which is not very high at all. It's really your typical running shoe, I think. If you have some flexibility in the shoe, you want to be able to bend it a little bit, but you shouldn't be able to bring the toe to the heel. It shouldn't have that much flexibility in it. So if you look at some shoes that are marketed that way, that you can bend them that way, it's good to have a little bit of flexibility in it, but not too much, because you still need that support for you. You want a firm heel that will support your foot, that will support the heel so that you get that proper bend in the heel motion. and shoes, like I said, that are made for your foot shape, that wide foot. If you have a longer foot, if you have a higher arch shoes that are your Nikes, they're made for longer feet, not for wider feet, as well as higher arch people. Birkenstocks can be good for sure because they will form to the arch of your foot. They'll form to your feet in the way you walk, which can be great. But the best brands, clinically proven brands anyways, for your feet for supportive footwear are your Asics, your New Balance, your Hoka's, and your Brooks. Hoka shoes are best for runners, avid runners, and long distance runners. Brooks are great for wider feet like myself. So now we can talk about a little bit of orthotics. Orthotics also include leg braces, ankle braces, any knee braces as well. Those are also orthotics, but they're best known to be insoles in your shoes. So the orthotics are prescription medical devices that you wear inside your shoes to correct biomechanical foot issues. They're custom made for you. We do them at the clinic. So if you go in for an initial assessment for orthopedics, they're going to look at your feet, look at how they move, they'll look at your gait, see what's going on with your feet, where you need that support. If you need the support in your arch because your foot has fallen, it will help support your arch and push it up a little bit into the position that it's supposed to be. It could be for your big toe if you're not getting that movement properly. You could leave a little bit of a hole there so that you get that bend in your foot the way you're supposed to. Or it could help with other things like arthritis, bursitis, shin splints, knee pain, if you have ankle instability. It could help with all of those things. It just means that it's custom made for you and your needs to meet your goals so that you are pain-free when you're exercising. So now we're getting to the end here. So I'll just point out that the code you see on the side of your screen, if you take your phone, you go to your camera and put it up to your screen now, it'll open a link for you. But anyways, so how—
I'm gonna try it, Alex.
Okay. So how the Kawartha Healthcare team can help you is that your massage therapist, like myself, there's one of 5 of us, are all qualified to help you. We can analyze your gait and your posture. So feel free to book an initial massage therapy visit with us. We do, like I said, we do orthotics at the clinic as well. So book an assessment with Dr. Jillian Edgar or Dr. Daniel Nicewander, and they're very energetic and excited to help you with all of your needs. Or if you're not sure what's best for you, if you have any questions, if you have any other, what else could work for me? Book a virtual complimentary consult with any of our practitioners, including myself, to answer any treatment questions you may have. That includes physiotherapy as well. If you have any other needs, feel free to log on to kawarthacare.com and take a look at all of our practitioners, what they could do for you. We do have we have 16 plus practitioners that have so many different skill sets, and they're all brilliant. So if you ever need anything, just look on there, book a consult, and we will answer any questions you may have. Thank you very much for joining me today. It's been a pleasure. Feel free to go on the link, book an appointment for any foot care needs you may need. And it was very nice to meet all of you.
Awesome. Thank you so much, Alex. That was awesome. Could you do me a quick favor and just pop onto the screen prior to so that we can look at the QR code? It worked really well.
Absolutely.
Awesome. So I tried it just for those who aren't as tech savvy as Alex, and it worked really well. So it pops on to the link for appointment bookings. And just to reiterate that, Alex has provided us a wealth of knowledge. And I think a lot of people with that knowledge, you want to be able to do something with it. And so we have 2 options here. You can definitely go to the QR code and you can book a discovery call or a consult, and it's 15 minutes. So what Alex would be able to do is actually see you on the screen, and she would be able to then touch base with you and walk you through some of the concerns that you might be experiencing, and then sort of have a chat with you. If you would rather chat on the phone, you can always call the clinic, and what we call it is sort of like a little, almost like a telehealth or complimentary hotline. And you can also book a 15-minute consult that way with Alex, and you can you can talk to her on the phone. We will be uploading that, Alex, because I'm not seeing that right now, but For right now, whoever does want to do the consult, you can go ahead and book it. You can also, you can leave your name just at the screen below, and we can get back to you tomorrow and go through that with you as well. Any questions that anyone has right now, or anyone has any concerns that maybe they want to touch base with Alex about in regards to your feet, knees, anything else, please feel free to pop onto the chat or the Q&A below, and we can answer those questions. So I'll give you guys a minute. I have a question, Alex. So I get a lot of people, well, I used to get a lot of patients that would ask me, look at my shoe, look at the inside of my shoe. You know, it's flat at the bottom, or it's like pressed down at the bottom or pressed down in certain areas. What does that mean? So just as a quick exercise for everyone who's here, if they were to look at their shoe, what, I guess, should they be looking for if there's any that would tell them that there may be a concern, or a concern that may be approaching, I guess?
Okay. So if you, for example, it's the first thing that came to my mind. So if you were ever a kid and you got out of the pool when you were anywhere, and then you had wet feet and you stepped on the cement and you could see your foot, you could see your footprint. So you could see the shape of it, if it was high or low. So if you have a, so for example, the one on the screen is like is a good healthy footprint.
Okay.
This one here. If it is flat, it will, if you have a lower arch, it'll be thicker in the midpoint. So where you have the toes there, and then it goes kind of a funny shape, and you can see where your heel is, it would be much flatter in the middle part there. If you have a lower arch, if you have a higher arch, it'll be a little bit thinner in that middle part. So that's how you are stepping down, and that's how your arch is, what your arch is doing when you're walking. That's what you want to look for. So if you're looking at a Birkenstock, it'll be about the same. So it's your footprint that way. If it's super high, if it's very thin, it's like pretty thin like that, and then it shapes out like this at the end, that's your higher arch. So that's when you want to try and accommodate your foot. You want to strengthen that arch and bring it down a little bit. And the opposite, if you have a fallen arch, it'll be way flat. It'll be kind of like this. It'll be pretty flat like that. It won't have much of a shape at all. That's when you have a fallen arch.
Perfect. Yeah, because I think a shoe is like an easy way to kind of assess yourself, but
Sure.
you can also show us your shoe if you do a virtual with us as well. Okay, there's a question for you. Okay, so if I insert orthotics in my shoe, does my shoe size should be bigger, or should it be the same?
So the way I'm thinking of it is that if your shoe size is the same, it means you're wearing the right size of shoe. If your shoe size needs to be bigger, it might mean you're in the too small of a shoe to begin with, because your orthotics are custom made to the length and size of your feet. I hope that answers your question. So you may need to get some new shoes because you realize, oh, my shoes are too small, or oh, my chiropractor, Dr. Jill, told me these shoes aren't right for my foot shape. That's when you need to look at new shoes, or if they don't have enough support for you.
And that's perfectly, like, I would think the same. So with orthotics, they used to come a lot bigger than the actual shoe size. So people were confused. And then we would trim around and then put them into your actual shoe. But they no longer do that. And we imprint the foot itself. So they should actually come to the size that your foot is in reality. So exactly what you're saying, and like spot on for sure.
Beautiful.
Any other questions or concerns? Okay, so nothing else right now. Lots of good information. Thank you again, everyone, for joining us this evening for the webinar. Lots of definitely things to think about. And I think, you know, Alex, you've provided us with so much knowledge that if anybody does have any questions, please, again, feel free to pop on to that QR code or give us a call or email us, so on and so forth, and we'd be more than happy to help you out in answering any questions that you may have. Sometimes you think of those questions while you're sleeping at night. You can call us in the morning. Thanks again, everyone. Thanks, Alex.